Under World Trade Organization rules, all WTO members must adhere to a set of minimum standards for the protection of intellectual property rights within their domestic legal systems. These standards are set out in the Agreement on Trade-Related Aspects of Intellectual Property Rights, or the TRIPS Agreement, and include provisions for the protection of inventions and works through codified patent, copyright, trademark, and undisclosed information rules. Patents are a type of intellectual property right that provide inventors with the temporary right to exclude others from making, selling, or importing the patented invention, usually for a period of 20 years. In the pharmaceutical space, patents have been frequently criticized as the legal mechanism through which branded manufacturers are given the opportunity to exercise monopoly power and underproduce needed pharmaceuticals, resulting in prohibitively high prices. In 2001, the relationship between patents and access to medicines was implicitly recognized by the WTO through the Doha Declaration on the TRIPS Agreement and Public Health, which reaffirmed WTO members' right to employ TRIPS flexibilities such as compulsory licensing to protect the health of their populations. Compulsory licensing occurs when a government forces a patent owner to license their patented technology to a generic producer in exchange for a reasonable royalty, thereby increasing the market supply of the patented product. In October 2020, as a response to the COVID-19 pandemic, a wholesale waiver of the patent, copyright, industrial design, and undisclosed information sections of the TRIPS agreement was proposed at the WTO by India and South Africa. Under their original proposal, this waiver was intended to apply to all COVID-19 related health products and technologies, including vaccines, therapeutics, medical devices, and personal protective equipment. Negotiations proceeded for the next year and a half, and by May 2022, the scope of the proposed waiver had been narrowed to just COVID-19 vaccines. In June 2022, a TRIPS waiver compromise was finally reached between all WTO members, providing developing country members, a self-elected membership status, with the ability to use the patents required to produce COVID-19 vaccines without the patent owner's consent. Throughout negotiations, public responses to the TRIPS waiver were highly divided. In the lead-up to the June 2022 compromise, we sought to identify key stakeholders' positions with respect to the TRIPS waiver, and in particular, to probe their understanding of the relationship between intellectual property rights and access to medicines. To do this, we identified the public statements made by all 164 WTO members, over 350 civil society groups, and 66 pharmaceutical industry stakeholders about the TRIPS waiver. When analyzing these statements, we sought to answer two primary questions. First, what was the identified stakeholders' position with respect to the TRIPS waiver? That is, did they support or oppose it? And second, what was the rationale they adopted in support of their TRIPS waiver position? We found that approximately 60% of WTO members supported the proposed TRIPS waiver, either in its original form or in its May 2022 iteration. Approximately 20% of WTO members opposed the waiver, and the remaining 20% had either equivocal or undetermined positions. By contrast, all surveyed civil society groups supported the TRIPS waiver outright. Finally, we surveyed the public statements made by the world's 20 largest pharmaceutical manufacturers involved in COVID-19 vaccine development, and a group of pharmaceutical manufacturer trade associations. We found that approximately 56% of these actors actually authored public statements about the TRIPS waiver, and of these, 87% were opposed, while the remaining 13% were equivocal. We then compared the rationales advanced by these groups in support of their TRIPS waiver positions. We found that rationales tended to overlap significantly between stakeholder class. That is, the rationales advanced by WTO members in support of their TRIPS waiver positions tended to be rationales that were also advanced by the civil society groups or pharmaceutical industry stakeholders who shared those same TRIPS waiver positions. For example, among both WTO members and civil society organizations who supported the TRIPS waiver, nearly all accepted the premise that intellectual property rights were acting as a barrier to pharmaceuticals access during the pandemic. By contrast, among the WTO members and pharmaceutical industry stakeholders who opposed the TRIPS waiver, nearly all adopted the position that intellectual property rights were not relevant barriers to COVID-19 vaccines access, and instead cited determinative factors including supply chain issues, trade restrictions, raw material scarcity, and population-level vaccine hesitancy. WTO members differed from their position counterparts in two key respects. First, WTO members who supported the TRIPS waiver advanced the unique argument that, contrary to the assertions of their opponents, a TRIPS waiver should be viewed as consistent with existing WTO rules under Article 9.3 of the Marrakesh Agreement, rather than as an exceptional departure from the existing rules. Second, WTO members who opposed a TRIPS waiver on the rationale that doing so would disincentivize future innovation frequently did so in reference to sector-wide domestic economic development priorities, whereas pharmaceutical industry stakeholders did so in reference to more granular R&D projects. All stakeholders acknowledged the importance of rectifying the asymmetric international deployment of COVID-19 vaccines. However, only civil society organizations consistently and explicitly contextualized the TRIPS waiver in relation to the human right to health. Most other stakeholders declined to do so, with nearly all pharmaceutical industry stakeholders and 40% of WTO members taking the position that a waiver of countries' international IP obligations under the TRIPS agreement would fail to achieve equitable access to COVID-19 vaccines within the desired emergency timeline. By emphasizing the risks posed by a TRIPS waiver to product quality and supply chain stability, as well as advocating for alternate vaccines access solutions, such as technology transfer agreements with developing countries, increasing health infrastructure funding, and implementing public health education programs to combat vaccine hesitancy, these stakeholders echoed many of the pro-IP arguments advanced during compulsory licensing debates surrounding the early 2000s HIV/AIDS crisis. This suggests that historical stakeholder divides on the relationship between intellectual property and access to medicines have remained largely unchanged, and, given the WTO's consensus-based decision-making process, underscores the continued lack of reliability countries face when looking to the international trading system as a means to advance public health imperatives and to improve access to life-saving health products. As WTO members currently consider the adoption of an expanded TRIPS waiver, the COVID-19 pandemic continues to spread globally with new emerging variants. Without improved international coordination, transparency, and consideration for the health and human rights of all global citizens, states risk remaining ill-prepared for future pandemics and global emergencies. Governments must continue to collectively strive toward the development of equitable solutions so that meaningful progress can be made to improve global access to essential health products. Without decisive action, countries risk being unprepared for future public health crises and continuing to propagate patterns of health inequity.